Thank you, Mr. Chair. Good morning, everyone. It's my pleasure to present on behalf of the co-authors today. And I'm glad that Dr. Ilya and Tak from Cebu City also sitting there in this session. In the next 10 minutes, I'm going to present briefly HIV epidemic in the Philippines, in Cebu, and also highlight the advocacy efforts and technical assistance provided in order to get the policy breakthrough on harm reduction in the Cebu. And finally, a brief summary of lessons learned and recommend the way forward. As you know, in the Philippines, and the Philippines is now one of the 9 countries globally experiencing the fastest growing HIV new infection over the last decade. Since 2013, every 2 hours, 2 Filipinos become HIV infected. Overall, the HIV prevalence in the Philippines remains low. However, there are cities with concentrated epidemics among key populations, including MSM, PWID, and freelance female sex workers in Metro Manila and Metro Cebu. Cebu is an island province central in the Philippines. The Metro Cebu has a population about 1.5 million. There were estimated 6,000 people who inject drugs in 2011. Out of them, about 2,000 living in Cebu City. IHBS survey has found that 98% the PWID are using nalbuphine, which is a regulated painkiller. Only until 2011, nalbuphine was included in the list of dangerous drugs. Before that, it was easily available and accessible over the counter in the market. Sorry. 53% of male PWID were living with HIV, which was identified in 2011, and 30% female PWID reported HIV positive in 2013. Obviously, this is a public health crisis. Until April 2013, only 60 PWID had access to needle syringe program services. In addition, there's also an increasing concern about the rise of non-injecting pregnant women tested HIV positive. This slide shows another public health crisis, which reported very high hepatitis C prevalence among injecting drug users in Cebu City. Sorry. So there are a number of reasons that cause the delay in response to the HIV problem in Cebu City. One of them is due to the existing conflicting laws. The AIDS law does support HIV response among key population, including people who inject drugs. However, the danger drugs law impedes HIV response. For example, one can be arrested only because of possession of needles even without any drugs. This caused a big problem to the peer educator who want to bring clean needles to the community where the PWIDs congregate. Another reason for the delay in response is so-called chicken and egg situation. Given the very decentralized administrative system in the Philippines, goodwill at the central level will not automatically translate into action. Following discovery of HIV outbreak in Cebu, the Department of Health has expected local government to take immediate action. However, the people in the local level insist that only if a central level policy has been made available, and any action, serious action can be taken at the local level. So this has become a game of chicken egg. In the reality, and the more challenging is that people tend to use the drug law to explain why no action has been taken, rather than using AIDS law to support immediate efforts, which is very necessary. On request of the Department of Health of the Philippines, WHO provided direct technical assistance to Cebu City since April 2013. A harm reduction expert team was sent to the field to look at the local situation, to review the local data and packaging them together with international harm reduction experience into a policy advocacy paper. And a series of advocacy meetings with different stakeholders, including training police, were conducted, and in the end, a proposal for a pilot community-based harm reduction program was prepared and submitted to central level for approval in June 2013. Advocacy works. It is increased the understanding of drug use issue as a multiple health problem that require multi-sectoral collaboration. It also increased the understanding about the importance of access to essential health commodities, condoms, needle syringes as a human right. The particular importance that for public security to have understanding about the public health approach that improves public security. So during the training with large bunch of police officers, they have understand harm reduction as part of the overall public security. Working with police is key to create enabling environmental harm reduction implementation. At a training workshop for the police, all the audience were enlightened by a Catholic brother who says that clearly distributing needle, syringe, and condoms is controversial in a Catholic country like the Philippines. However, for the sake of saving lives, love is above law. It makes a lot of sense to argue that if a Catholic brother can do, who else cannot? A consensus was eventually reached among all key local stakeholders. The program was signed off by the mayor. So all the efforts made to find a local solution for a local problem. In the meantime, at the central level, the Dangerous Drugs Board is also exploring how best they can to find a way to support community-based pilot and in the context of current law. The community-based pilot is interpreted as an experiment under the natural laboratory. So this is how things get moved. So the WHO recommended 9 priority programs for PWID is now implementing in the Cebu Social Hygiene Clinic for free of charge, except the opioid substance treatment. The referral for rehabilitation is also provided on voluntary basis. Cumulatively, 600 to 800 PWID has been saved by the needle syringe program. The ups and downs in number mainly related to the restriction, the level of restriction of distributing. So the number could be increased sharply once the restriction has been lifted.